Hello friends, I am Dr. Firuza Parekh. I am the director of the Fertility Jaslok International Fertility Center in Mumbai. Today I am going to talk on a very important hormone which is called the Anti-Mullerian hormone and how it correlates with fertility and infertility. This hormone has become a very important marker in counseling and guiding women about their reproductive choices. As you know, a woman is born with a finite number of 500,000 eggs at birth, and these eggs are present in a dormant stage in the ovary. The number of eggs in the ovary form the ovarian reserve of a woman. So what is this anti-Mullerian hormone? AMH is a hormone which is secreted by cells in the developing egg sacs, which are called the follicles scientifically. So the level of AMH in a woman's blood is generally a good indicator of her ovarian reserve. Who needs ovarian reserve testing? Women who are infertile and in the slightly over the 30 age group would need AMH testing. Also, those who are exposed to some form of gonadotoxins such as tobacco smoke, chemotherapy, radiation therapy, those staying close to mills in those cities where the pollution is very high, these are the people that will need to be checked for AMH. When there is a strong history of early menopause in the family, or if a sister or mother has undergone a premature ovarian failure, it is worthwhile to ask for an AMH. Another condition where a woman has undergone extensive ovarian surgery like removal of a cyst or removal of an endometrioma or sometimes removal of an entire ovary would definitely need to do the AMH. There are several ways of testing for ovarian reserve. One is through hormone analysis. Here one can use the several hormones: FSH, LH, estradiol, progesterone and AMH. But of all these today, the standard that is used is AMH. There are other techniques such as ultrasound, where using a very specialized ultrasound machine, the doctor or the sonologist would be able to pinpoint how many follicles, or what is known as the antral follicles, are present in each ovary. Usually, if somebody is fertile, we would anticipate at least 10 to 12 follicles in each ovary. Women with polycystic ovaries will have more than 15 to 20 follicles in each ovary. There are other dynamic ways of testing which we will talk about a little later on. So let us understand the role of AMH. Why is it so important in treating infertility? The intrafollicular concentrations of AMH in the normal human antral follicles shows a gradual reduction as the size of the follicle increases, and there is a sharp fall in this level once the follicle reaches about 8 millimeters. The physiological function of AMH is to prevent too many follicles from developing, because if too many follicles develop, too many eggs will be used up in a cycle, and every cycle only one egg is needed for fertilization. There are some important factors which could decrease the AMH level. As our age increases, the AMH falls. Obesity and a high BMI can be associated with lower AMH. People who smoke and who have excess consumption of alcohol can also have a low AMH. People undergoing chemotherapy, radiation, gonadotoxic therapy also can have a low AMH. If one or both ovaries are removed, of course the AMH will fall. And one thing that doctors sometimes miss out on is not to perform an AMH when a woman is on contraceptive pills, because the AMH will always come low. So there are parameters set which tell us what the blood levels of AMH should be. Women with polycystic ovaries usually have an AMH ranging from more than 3.5 to 10. Somebody who has a normal range would be somewhere in the range of 1.8 to 2.5. A low normal range is from 0.8 to 1.3. A very low AMH would be 0.3 to 0.6, and AMH not detectable or very low would be less than 0.3. So when we are doing these certain tests, we have to keep in mind the age of the woman. The older the woman, the less will be the AMH. Lower AMH levels at any given time, irrespective of the reproductive age of the woman, predicts a poorer response to assisted reproductive technology. High AMH levels are associated with women with polycystic ovaries. Here, the reproductive endocrinologist has to be very careful in the dose given for ovulation induction, because such women are more prone to OHSS, that is ovarian hyperstimulation syndrome. So there is a certain importance of the AMH. It is one of the earliest marker to change with age. It shows the least variability between two menstrual cycles. It can be randomly measured on any day of the cycles. It is very convenient and informative as compared to a basal FSH. So in clinical practice, it is worthwhile when a couple comes to you and we are suspecting a female factor to do an AMH and also do a good ultrasound to look at the antral follicle count. Both of these are predictors for how many eggs we will retrieve at the time of IVF, and also what would be the likely peak estrogen level with ovarian stimulation. Let's talk a little bit about the antral follicle count. As I told you earlier, usually an antral follicle count will vary between 10 in one ovary to about 15 in an ovary. A poor responder will have less than 6 or 7 antral follicles, and a higher responder sometimes will have anywhere from 20 to 30 follicles. There are certain factors which will affect this count, and those are use of oral contraceptives. Sometimes polycystic ovary syndrome will show a very high antral follicle count. Sometimes the sonologist will look at the entire ovarian volume to see how many eggs are being produced or likely to be produced. So friends, to summarize, in this video I have tried to show you the importance of AMH and also antral follicle count, because these are good predictors of ovarian response and ultimately how a woman will fare in terms of pregnancy rates.